So there are pretty much two different types of facelift patients. There's the type of patient that really doesn't ever want to look old as long as they can stave that off, or there's the type of patient who really wants to get their money's worth from their facelift procedure. The first type of patient tends to be younger, maybe from age 40 to 45 or 40 to 55, and they start seeing changes of aging, and then they want to reverse those as soon as possible. The second group of patients want to notice that they have aging changes and look old before they start looking young again. So the best age or best candidate for a facelift is really anywhere over the age of 40, depending on your individual anatomy and your needs. So there are definitely different types of facelifts available depending on the patient's needs and wants. So the most traditional facelift will elevate the fatty deposits that have fallen down into your jowls and neck. That will require an incision in front of and behind your ears. Some other facelifts can be a neck lift only, a jowl lift only, some version of those two that's smaller than the first traditional method I just mentioned, or any of those methods can include a brow lift. So I get this question a lot: how long will a facelift last? So in general, a facelift will last about 7 to 10 years. So what happens is, if you're 45 years old when you have a facelift, I can probably make you look somewhere between 35 and 37 years old. 10 years from then, you will then look 10 years older, which would be 45 to 47 years old, but you'll actually be 55 years old. So you never really regain the age that you have lost from the surgical procedure. You will always look better for having had that surgery done. The recovery process for a facelift can last anywhere from 10 to 14 days, depending on what type of facelift you have. Every facelift should be tailored for the individual patient, of course. But you can expect to have a bandage over your face and neck for the first 24 hours, come into the office and have that removed, and then for the first week you really need to curtail or limit your activities and recover at home. The second week you can start advancing your activities and your social activities to spend some more time outside or with your family. By about 2 weeks, you should be able to go back to work without anyone knowing what you've had done.